In our series, Vaccinating America, there is concern that some of the most vulnerable Americans are now being left behind in vaccination efforts. We are talking about people who are unable to leave their homes. More than 1,100 members of the Texas National Guard were recently deployed to help vaccinate people who are either too old or just too ill to get around. Nikki Battiste shows us how a nonprofit home visit nurse program in New Jersey is also trying to reach homebound people who are not yet vaccinated. Good morning to you, Nikki. This sounds really interesting.
Gayle, good morning. It's an important story because so far the New Jersey Health Department has not allocated a single vaccine specifically for the homebound. That's why the Visiting Nurse Association here just began a pilot program using vaccines given to them by community health centers. Our cameras followed one of their nurses driving doses door to door.
I'm carrying something that's so valuable, so yeah, I'm going to watch every little thing I do with it.
Packing up vaccines in a temperature-controlled cooler.
Don't jiggle it, don't shake it. It's like liquid gold. You're carrying this. It's, let's hope that this changes the crazy world we're in.
Nurse Peggy Lasoff hits the seaside roads of New Jersey, making a special kind of house call.
What one am I getting, by the way?
You're getting a Moderna.
She's administering first doses of COVID-19 vaccines to homebound patients, the elderly, and those suffering from medical conditions who can't get to a vaccine site. We joined Lasoff as she went to them, house by house, for hours. Lasoff is a crucial part of a pilot phase the New Jersey Visiting Nurse Association Health Group has launched, which could become a framework for the nation.
I'm Peggy. They're very appreciative. They've been nervous and scared because they obviously can't get out to get it.
The longtime nurse gave 79-year-old Vincent Newland his first COVID-19 vaccine.
Relax for me.
He has heart disease, lung disease, kidney disease, and multiple myeloma. So he has a lot going on.
His daughter, Tyann, told us her dad's dose came after an unexpected phone call.
They called us and said that they were starting a pilot program and if he would be interested in getting it if they did. It was just like, yeah, like, you want to do it now?
They're kind of living in the shadows. They're easy to forget about, but there are parents, there are elders, and they need our help.
Dr. Steve Landers leads the health group. He and his nurses treat 10,000 people in New Jersey on any given day.
The states have not prioritized giving the home health agencies themselves vaccine products. So there's over 12,000 home health agencies across the country, and they serve these millions of homebound people.
I see constituents every day who are in their 70s, 80s, 90s who can't get vaccines.
New Jersey State Senator Vin Gopal says his office has received countless calls from the homebound. So he contacted New Jersey Governor Phil Murphy.
I've raised it directly with him that we need to move away from this open portal system. This needs to be done in a more targeted approach.
What was Governor Murphy's reaction in general? Did he seem to understand?
We'll look into it, and so we'll get back to you.
What do you say to state officials who seem to have the power to expedite this process?
I've been speaking to everybody I can about the importance of focusing on the homebound. I think that the message is getting through.
I didn't even feel it happening. That's a good thing.
Dr. Landers says this effort is not only about their patients living, but having a reason to.
Maybe they can feel more safe with their family coming over and giving them a hug.
A lot of power in a hug.
You have to survive the virus, but you also have to have a reason to live in family connections, in joy, and love and care.
In a joint statement, Governor Murphy's office and the New Jersey Department of Health told us that as vaccine supply increases, mobile options to reach vulnerable populations will be incorporated. The statement also said the state has had initial conversations with the Visiting Nurse Association about prioritizing the homebound. Yeah. Anthony?
Thank you, Nikki. Yeah, it's so disappointing that these home health agencies have not been prioritized. It's hard to understand why. What Nurse Peggy Lasoff is doing there is so important.
I call that angels on earth.
Yeah, exactly.
Nurses that get in their car, go to people's homes.
Door to door.
To help you talk about door-to-door service. I think Nikki Battiste said it very well. There's a lot of power in a hug.
Yeah.
Vaccine gives you some of that. One-step reality getting closer to a hug. I think it's so important.